Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome to episode 2 on nurses' mental health, suicide awareness, and prevention. Thank you, Dr. Mariah Ward, for continuing this discussion with us.
Yeah, absolutely. I'm excited to be here.
I personally really find this to be such an emotional topic to discuss, but so important to keep at the forefront of our minds so that we can look out for our peers and for ourselves who maybe are struggling and maybe we don't even realize it because we're so busy helping others. If you have not already, I really encourage you to listen to episode 1 of this series. But before we move forward, I do want to warn our listeners that this episode discusses mental health issues like depression, PTSD, and suicide. We do believe that these are some really important conversations to have, but we also know that they can be difficult for some of our listeners. So please be aware of the topics that we're going to be discussing and seek help if you need it. To start this conversation, I want to talk about healthcare organizations and leadership. Is there a role for healthcare organizations to play in fostering a more supportive and compassionate workplace culture that really prioritizes mental health of the healthcare providers?
Yeah. I think that, when we prioritize mental health from the top down, so leadership needs to be committed. So leaders have to openly acknowledge the impact of work-related stress, destigmatize mental health challenges, and emphasize well-being as a core value of the organization. We have to prioritize policy development, so creating clear policies that promote mental wellness, non-discrimination, and access to support resources. And we want to allocate the right resources. So we want to dedicate funds towards mental health initiatives, training programs, and support services. We can foster a supportive work environment. So we want to address workload and staffing, implementing safe staffing ratios, offer flexible scheduling options, and provide adequate breaks during shifts. Mentorship and peer support. So establishing formal mentorship and peer support programs that build connections and offer confidential support. We want to encourage healthy communication. So we want to promote open dialogue about mental health, encouraging debriefing after complex events, and providing training on respectful communication and conflict resolution. We can do mental health education and awareness. So regular training on stress management, burnout prevention, recognizing the signs of distress and how to support our colleagues. We want to normalize conversations. So leaders and managers regularly checking in on employee well-being and creating safe spaces for open discussions about mental health and reducing the stigma. So like campaigning to dispel myths about mental health and ensure everyone knows that seeking help is a sign of strength and not really emphasizing a punitive culture. We want to provide accessible resources, so employee assistant programs, which can offer confidential counseling, crisis support, and referrals for further mental health care. Wellness programs, so promoting healthy habits through workshops on stress management, mindfulness, sleep hygiene, and nutrition. Wellness programs also kind of can have that, like I know some organizations have gyms and give their employees either discounts or free access to that. We want to designate quiet spaces for rest and relaxation on breaks and really encouraging nurses to give their phones up. I know that's a big one. You want to do support groups, so facilitating optional support groups for nurses who have experienced trauma loss or other specific stressors, which let's be honest, that's all nurses. And we want to do ongoing evaluation and improvement. So collect feedback from staff to regularly gauge stress levels, burnout, and satisfactions with the mental health support. And we want to adapt and respond. So we want to use that data to identify areas for improvement and adjust our programs accordingly. Creating a mentally health workspace is an ongoing commitment. You cannot do this once and expect it to be effective. We have to prioritize these initiatives to foster a culture of well-being and leading to a happier, healthier, and more resilient workforce. So we can't just do it once. We've got to do it multiple times and consistently, and doing a variety of things. We can't just have a pizza party on Wednesday. That's not going to be
Oh
effective for the
man.
whole
How
nursing
about ice
staff.
cream?
Yeah,
We could bring
right.
some ice cream. That was another one besides pizza. Ice cream would come around
Yeah.
on the little cart. So that's a lot to unpack
Yeah.
that you just
Absolutely.
shared. So I want to unpack two things from that. The first thing I want to unpack is you mentioned debriefing, and we've talked a little bit about debriefing in episode 1. The only time that I have, debriefed would be after a simulation in the education department, right? Student,
Yeah.
or after a code, they're like, "Oh, sign our debrief sheet." How? What are some ways to debrief? When should we be debriefing to help with limiting the hits to our trauma center?
Yeah. So ideally, we should be debriefing between 24 to 48 hours after an event, before our brain really has time to kind of click it into our trauma centers. And ideally, even before that, but sometimes that's not realistic. We can debrief kind of in an informal way afterwards with maybe the charge nurse leading a little like session or group that's kind of like, okay, like, how is everybody feeling? How are we doing? And even providing like a debriefing maybe a day later after that, informal debriefing where it's led by leadership and management, and they kind of have like this debriefing session. Maybe it's even offered as a virtual option so that people don't have to necessarily come back to the hospital to attend it if they're not working, and that being encouraged as part of the standard practice. Like you said, it's the debriefs usually happen in simulations, and real life is not a simulation, and debriefing in a
No,
simulation is not the same as debriefing in real life. And that's really something that we need to be doing, is debriefing in real life.
absolutely. Now, if I say I'm a nurse manager on a floor, and you mentioned a lot of things that we can we foster a supportive and compassionate workplace. But if I'm a nurse manager, what are some things that I could quickly do with my staff and with that unit to start building a culture of wellness?
Yeah, I think encouraging the debriefing sessions, right, in real time, training the charge nurses and changing charge it. Mm, training your other
That's the
staff, like
word.
your leadership, there you go, training them to create to kind of debrief. How do we do it? Even if it's
Yeah.
informal briefing and then we do a more formal briefing later, like, how do we do that in real time? So encouraging that during stressful events, and then really fostering and creating a safe space. So where on the unit can people go that's quiet and safe? Who can we reach out to? Designating somebody on each shift to kind of be like the go-to person, or even having multiple people that could be kind of support systems. And so really fostering that, peer support and mentorship as a key component. And mentorship has to go beyond just one day-to-day interaction. This has to be a
Hmm.
long-term mentorship, and so making sure that you're pairing people together um, during training that maybe are going to build lasting relationships together, so that when they're struggling, that they know somebody that they can go to about how they're feeling.
And somebody that gets to know them as a person, their personality. That way they can identify before maybe even that nurse realizes that there's something going on. Some of
Yeah,
those mood
absolutely.
changes and things that you mentioned before in episode 1. What resources are available for nurses who are experiencing things like depression and burnout and PTSD and suicidal ideation?
Yeah, so there are crisis support for everybody. So there's the National Suicide Prevention Line, now 988, which is 24/7 confidential support for emotional distress and suicidal crises. They also have a crises text line. You just text home to 741-741, or you can visit their website and they have 24-hour crisis support via text. This is really for everybody. So they're not going to be nursing specific. Nursing specific, the ANA has a Healthy Nurse, Healthy Nation. So this is a focus on nurse well-being, that have resources on preventing burnout, suicide awareness, and accessing mental health support. There is a nurse suicide prevention and awareness initiative. So many organizations may provide resources geared specifically towards nurses struggling with suicidal thoughts. And then there is the Short Center for Compassionate Healthcare, which offers programs and resources addressing emotional well being and burnout in healthcare. Um, Other resources might include mental health treatment through employee assistive programs, which usually do provide EAPs, which offers confidential support and counseling services, seeking out individual therapy from a mental health professional specializing in healthcare worker trauma, burnout, or other specific conditions like depression and PTSD. Also, peer support groups. So there are in person and online, and it's a safe space to connect with other nurses who are like facing very similar challenges. And then there is the National Alliance on Mental Illness and mentalhealth.gov, which have some resources. But that's usually, those are the kind of ones. The one that I really, focus on and emphasize is definitely the National Suicide Helpline, which is 988, especially if you're actively having suicidal ideation. But using the nurse specific support can also help, and then always do the EAP with your organization, and
Mhm.
kind of knowing that, and kind of, sometimes we don't do a great job as a healthcare organization of talking about EAPs, but, giving access to employees for an EAP is really crucial.
Now, if I know somebody or if I hear somebody, maybe a coworker, and they're, talking about suicide or I just see something's not right. Are there resources or things that I should do on behalf of my coworker or friend or
Yeah, so I think especially if it's your coworker, reporting it to kind of like upper management and being like, "Hey, I'm concerned." I know managers have generally have better access to be able to refer people internally to the EAP. At least historically, that's how my experience has been. Um, Sometimes on the individual, like peer to peer level, you can refer somebody to the EAP, but it's usually best done by somebody in management. And that would be like kind of one of my first steps if I were maybe hesitant to approach them. If I weren't so hesitant to approach them, I might approach them and say, "Hey, like, I've noticed things have been not so great for you. Like, how are you?" Like, and, if
Mhm.
they really open up to you and talk to you, kind of eventually slipping in, like, "Well, we have an EAP, right?" Or, "I could help you get connected to somebody who could help you out." And so I think that that's kind of the more crucial element, is just if you're not comfortable approaching them, obviously, then kind of going to management. But if you can approach them and build that rapport, especially if you already have that established relationship, that's really a crucial component, because people are going to be more willing to accept help from you if
Mhm.
you are actively engaged in them, and you have a relationship versus like your manager maybe you see once a week, is a
Right.
little different than somebody you see on a regular basis that you're working 12 to 15 hours with.
What do you mean by EAP?
Yeah, so that's the employee assistant program,
Okay.
and shortened to EAP. And most care organizations do have an EAP, especially larger organizations.
And if they were trying to find if their organization had one, they could just talk to their manager?
Yeah, I would say talk to the manager, or if you have an intranet, I know that most bigger organizations have an intranet. You probably could
Mhm.
search within on that and put employee assistant program. The other place that you can always go to if you don't want your manager directly to know is, you could ask an HR representative. Usually, HR, your human resources department's responsible for your employee assistant program. They're the people who kind of manage that. So that would be somebody you could ask that's maybe a little more neutral, than your direct boss.
Right. Don't wanna put our red flag up there.
Yeah, yeah, you might want to do a little more investigation on your own. And like I said, if you have an intranet, that's always a great place to start too.
Right. Yeah, absolutely. Wanna make sure that if we are worried about a coworker or a peer, that we also still have their best interest, in mind as far as what direction that we go in helping them get help. So,
Absolutely.
what self-care strategies do you recommend nurses implement to protect our own mental health, given such a demanding job that we have?
Yeah. So it's kind of I set this up in kind of like sections. So, like the basics, right? You want to
Okay.
sleep 7 to 8 hours a day. You've got to sleep. You want to develop a consistent routine for bedtime, and you want to create a sleep conducive environment, which means it's dark, it's
No
cold,
phone?
it's no phone, right? No phone. Usually, you want to avoid your phone about an hour before you go to bed. I know that that's rough, but that's usually what we like. And then nutrition. So you want to have nourishing meals and snacks with plenty of fruits and vegetables and whole grains. You want to stay hydrated, especially when you're working, right?
Hmm.
We tend to not pee all shift. I think that that's like the one thing that all nurses can brag about. It's like, I can hold my pee for 12 hours. It's like,
It's the
that's not
nurse
healthy, friend.
bladder. The nurse
Yeah,
bladder.
it's like that's not healthy, friend. And then if you can and exercise, engaging in moderate physical activity can reduce stress and boost your mood. So you want at least 30 minutes of day most days of the week. Another great thing is to set boundaries. Learn to say no. Don't overextend yourself with extra shifts or commitments, especially if you're already overwhelmed or burned out. When you can delegate, delegate. So ask help from colleagues or support staff when tasks can be redistributed, and disconnect from work. So establish clear boundaries between work time and personal time. Don't check your work emails or messages outside of your shift time if possible. This is really important for our salaried folks.
Yes.
then,
Yes.
uh, you want to do mental and emotional care, so mindfulness and relaxation, so practicing techniques like deep breathing, meditation, or yoga, therapy or counseling. So again, we kind of talked about that, but seeking professional support to process work related trauma, address burnout, and manage underlying mental health conditions, or even journaling, just writing down your thoughts and expressing yourself. And then nurture yourself, kind of love yourself, so you connect with loved ones, dedicate quality time to relationships outside of work to foster social support and maintaining a healthy work life balance. You want to pursue hobbies, so engage in activities that you find enjoyable and relaxing, reading, crafting, listening to music, or even spending time in nature. And then seek joy. So make a conscious effort to find small moments of joy and gratitude throughout your day, even amidst like the challenges and circumstances. And remember that like self care is not selfish. It is crucial for you to be able to provide quality care. Asking for help, you should never, ever, ever feel bad about asking for help. Contact your trusted colleagues, your supervisor, or even a mental health provider if you're struggling. And making small changes is even the is better than doing nothing at all. So even if you can't commit to a whole routine, even if like let's say instead of putting your phone down an hour in advance, maybe you can put it down 15 minutes. That's progress, and rather than doing it and getting 6 hours of sleep is better than getting 3 hours of sleep. So just making small changes as you can to kind of optimize your self-care. That's really what's ideal.
Do you find that fixers, healers, as we are, have a hard time taking care of themselves?
Yeah, I do. I think that we are so focused on other people that we forget that we're a person that also needs care and love and attention. And, we're a plant, just, we're an organism. So we need watering, we need feeding, we need the same love and
Yes.
care and attention that we give to other people. And it's okay to want that and to need that and to get that. And so sometimes we have this guilt of asking for space and time after work to kind of just debrief and relax, and we don't feel like we are deserving of the time and effort that we need to give to other people.
Right. I think it's also important for us to start to understand, and this is something I've been working on for myself, is yes, we were called, most of us, we were called into this field because we are healers and fixers, but it's also a job. And if I'm not at that hospital, they're going to hire somebody else in my place.
Yeah, and that's a trauma response, right? So the
Yeah.
reality is that while you are technically replaceable, right? To your organization. You are not replaceable to your friends. You're not replaceable to your family.
Yes.
You're not replaceable to the other people in your life. Maybe you have kids. You are not replaceable to them. So your organization
Absolutely.
can find another person to fill your spot, but they cannot. Your family cannot. You cannot be replicated. Yes, a nurse can be replicated, but you as the individual, as Candace, like you are not replicable. You are not somebody that can be replicated in the people in your life, and so yes, that it's okay to feel like your organization can replace you, but you can also replace your organization.
Yeah.
That's the reality, right? Is that we know
Right.
that there's a nursing shortage. So trust and believe. I get emails every day about nursing jobs, and I have not done a bedside nursing job in years. And I know for a fact that if I applied for one, I could probably get 15 interviews
Yes.
next week. So you
Absolutely.
yeah, so it's like if you feel like you're replaceable, just remember that they are also replaceable. Like it
Mhm.
works both ways, right? So, but you are not replaceable to the people in
Mhm.
your life.
But I
And so
think
that's
that's
really important.
also important to for us to wrap our head around too, is that we have to take care of ourselves. And if that means that we have to walk away from the job so that we can be there for in the areas where we're not replaceable, then maybe we need to do that. We need to take care of ourselves. And if that organization isn't taking care of ourselves, yes, we do have something to bring to the table to take care of our patients. We do. But
Yeah.
to that healthcare organization, you are replaceable. And so it's okay to leave and it's okay to take care of yourself.
Yeah, absolutely. I agree with that. And I think it's just knowing that you're not replaceable to some people and that's really like the key.
Absolutely. So, what types of training and mental health education do you think should be implemented in places like, well, for nursing school? I mean, maybe it should start in nursing school and hospital onboarding, or clinic onboarding, wherever it is that we work.
Yeah, I think, in terms of nursing school curriculum, I think teaching stress management and self care. So, teaching effective ways to reduce stress, healthy coping mechanisms and strategies for setting boundaries to prevent burnout, um,
Hmm.
education on recognizing mental or burnout and mental health conditions. So, educating students on how to identify burnout, depression, anxiety, PTSD, and suicidal ideation in themselves and their colleagues,
Hmm.
building resilience, so developing emotional regulation skills such as soft social support networks and cultivating a sense of self-efficacy and handling challenging situations, encouraging support, implementing training on providing essential peer support, offering a listening ear, and knowing how to connect with your colleagues with resources, and then destigmatizing mental health. So openly addressing the stigma surrounding mental health struggles in healthcare, and then emphasizing that seeking help is a sign of strength. That's really crucial in that nursing school curriculum. And then if we get that in nursing school, when we go to our organization, it's going to make sense when we have this workplace wellness and mental health resources, right? That when
Hmm.
we see that we have available support systems, including the EAPs, the counseling services, debriefing protocols, and how to access them confidentially. I think confidentially is key, right? That this information is not going to be spread with other people. Giving a realistic preview of job demands, so providing a balanced picture of the rewards and potential stressors that involved in nursing work to promote realistic expectations. God, that's so important. Um, Promoting a healthy work culture, emphasizing the organization's commitment to mental well-being, with policies that promote work-life balance, address staffing issues, and foster a supportive care environment, and educating leaders to recognize signs of burnout, offering compassionate support, and promoting a culture of openness. These are really important. And then, of course, doing ongoing education. So, doing refresher training like regular workshops on stress management, self care, and mental health awareness, trauma informed care. So, educating nurses on the impact of trauma exposure and how to provide sensitive trauma informed care to patients. And this will ultimately allow you to recognize trauma in yourself and give yourself kindness too, right? And
Hmm.
then provide training on recognizing warning signs of suicide and how to intervene appropriately if a colleague is struggling. So, just kind of like giving, not just saying that we're going to do this thing, but providing the resources and the policies and the procedures that back that claim up.
Right. What advice or message would you offer to nurses who may be contemplating suicide?
Yeah. You're not alone. Your feelings are very valid. Nursing is demanding and it can be overwhelming, which may make you feel like you're isolated and exhausted. So, there's no shame in seeking out help. This is honestly a sign of strength, especially once you're starting to get help. That's the first step. Um, Taking that step towards healing is courageous and shows a deep commitment to yourself. The yeah, it's okay to need that. if you do need help, consider speaking to a therapist who specializes in helping healthcare professionals. Remember that therapists are also healthcare professionals, so they know some of what you're going through. And just remember, like, you're valued and needed, and your presence makes a difference in the lives of both your patients, your colleagues, but your friends and family too. It's not just about your job. And that's the other thing too, is like your job, there will be nursing jobs tomorrow. But there's only you today, so you can't do any of that if you're not here. And so it's okay to need breaks and to need assistance and to need space and time to heal and recover.
I love how you said show kindness to yourself earlier.
Yeah,
What
I
does
think
that
that
look
that's really
like?
the pres Yeah, I think when you prioritize yourself, like, and you show kindness to yourself, I think it means that you understand that what you're going through is, especially because, we're very kind to other people, right? So why aren't we
Hmm.
kind to ourselves, and
Yeah.
like, if you tell me you have a PTSD and you're experiencing that, like, I have this deep sympathy and empathy with you. And then, but when I think about it myself, I'm like, well, it's fine. I can deal with that. Well, like, but why not show the same kindness? Like, if I were my friend and I were treating me like that, I would
Right.
be upset. So it's like,
Yes.
just treat yourself how you treat others, and by doing that, you'll come out a lot safer, I think, at the end of the day, of and a lot healthier when you treat yourself like, you should treat other
Yeah.
people. Hopefully you're somebody who treats people well. If you're a nurse, you probably are, but
Probably.
just
Probably.
probably.
I don't know though. I don't know. So collectively, how can we work to reduce that stigma so that nurses feel comfortable reaching out for mental health support when they need it?
Yeah, I think we can start by fostering a culture of open communication about mental well-being, normalizing conversations about stress, burnout, and the need for support. Um, Really getting leadership involved so that they can model vulnerability by sharing their own mental health experiencing, promoting resources, and creating policies that prioritize that. And then, actively challenging negative stereotypes and misconceptions surrounding mental health, including educating ourselves and speaking out against stigmatizing language or actions. And that's really, really important, to kind of highlight and emphasize, is that, it's okay to need help. And when we get rid of that language, it really reduces the stigma overall.
We could have talked about this topic for so much longer than our allotted time, but unfortunately, we're coming to the end of our time. So, as we wrap this up, what do you want the listener to walk away with?
Yeah, you're valued, and it's okay to not feel okay. It's okay to need help, and it's okay to ask for it.
Absolutely.
And yeah,
That's hard for fixers and healers. No, we need to make
yeah,
that
it's very hard.
need to make that less hard somehow. I don't know how, but we do.
Yeah, yeah, yes. We start by having this conversation today.
Absolutely. This was a great conversation. Thank you so much for sitting with me through this conversation. Um, um, Thank you for spending time with us on this topic and for sharing insight and support to our fellow nurses. And I really hope that if you're a nurse listening to this and you really feel that you need to talk to somebody, that you will reach out. You will reach out to somebody. Who can they reach out to any 24 hours a day, Mariah?
Yeah, that National Suicide Hotline, 988, or you can go to their website, as well, and speak to somebody via chat if you don't really want to talk on the phone with somebody.
Yes, we really encourage you to talk to somebody because you are not replaceable as a person. So, to our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.